It's my extreme pleasure to serve as a moderator for today's Ask an MS Expert webinar. I'm John Strum, and I'm the host of the Real Talk MS podcast. Each week, Real Talk MS reaches thousands of people in more than 90 countries around the world with the news that people affected by MS need to know. I'm also a non-scientist member of the International Progressive MS Alliance Scientific Steering Committee, where I work to ensure that the perspectives and priorities of families affected by progressive MS are represented in all of the projects and work undertaken by the Alliance. I'm a district activist leader for the National MS Society, and I also chair the Society's California Government Relations Advisory Committee. My wife, Jean, lived with progressive MS for 23 years, so I've had a front row seat experiencing all the ways that MS can impact a family. I'm thrilled to be with you today. I see that people are continuing to gather, so let's give them just another few seconds and then we'll get started. Thank you to all of you who are joining us today on GoToWebinar, Facebook Live, and YouTube Live. Due to the large number of participants joining us on GoToWebinar, everyone has been placed in listen-only mode. Today's Ask an MS Expert webinar is one of a series of virtual opportunities the Society is committed to offering, so I hope you plan on joining us each week. Our objective in all of our Ask an MS Expert programs is to connect with you, share important information that you can rely on, and provide a forum for you to connect with experts on the topics that are on your mind. So as I chat with our expert today, please feel free to post your comments and questions as they come to mind on Facebook and YouTube, or type them into the question box if you're joining us on GoToWebinar. I have a helper working behind the scenes with me today. Julie Fiel is ready and waiting to capture your questions while I'm busy talking. We'll try to answer as many of your questions as we can during the Q&A portion of today's program. And I know many of you might have some very specific questions related to your own situation. Because of our limited time together, we're going to be focusing on the questions that pertain to everyone. And following the webinar, the Society's MS Navigator team will be standing by to address those specific questions that you might have. I'll be sure to let you know how you can reach an MS Navigator before the end of today's program. And if you're interested in reviewing today's conversation with our expert, this webinar is being recorded and it'll be available on the Society's website for your reference. Before we dive in, I'd like to acknowledge that these are new and rapidly evolving times, so we do have a disclaimer I'd like to review. COVID-19 is a new coronavirus, and limited published data is available about this virus and MS. The information and recommendations presented in this program are based upon the individual professional opinion of MS experts and the evidence currently available about MS, infections, and disease-modifying therapies. This is a rapidly evolving situation, and we'll update information as it becomes available. The information that is shared does not substitute for your healthcare provider recommendations. Please check with your healthcare provider before making any changes to your treatment plan. And be sure to check the Society's website at nationalmssociety.org/COVID-19 to keep up with the most updated information on MS and COVID-19. Throughout our weekly programs, we hear regularly from those of you who want to know what you can be doing to help improve your quality of life beyond taking disease-modifying therapies. We're seeing a lot of questions about supplements, diet and exercise, and emotional health, as we're all dealing with the implications of COVID-19 and the unrest we're experiencing in our communities. So today's conversation will focus on integrative medicine in MS, an underutilized, evidence-based approach that's designed to optimize health. And we'll also touch on how this relates to COVID-19. Our expert is Dr. Alan Bowling, an internationally renowned neurologist, multiple sclerosis specialist, and integrative medicine pioneer in the Denver, Colorado metropolitan area. Dr. Bowling has a long-standing interest in MS and has a passion for providing care to those living with multiple sclerosis. He's currently the director of the NeuroHealth Institute and a clinical professor of neurology at the University of Colorado. Dr. Bowling, welcome and thank you for joining us today. When it comes to care,
thanks so much, and thanks for inviting me to be part of the program.
Well, of course. When it comes to care and treatment for MS, you've published over 100 articles in clinical and basic science journals. You've been involved in research related to nutrition, dietary supplements, and other non-pharmacologic therapies for the past 30 years. And you've authored 5 books, including Optimal Health with Multiple Sclerosis, a guide to integrating lifestyle, alternative, and conventional medicine. You're clearly passionate about this topic, and I'm hoping you can get us started by explaining what integrative medicine is and what got you interested in specializing in integrative medicine for multiple sclerosis.
I liked your use of the term passion. So yeah, this area is definitely a passion of mine, and I think because it kind of cuts deep to who I am and sort of my background history. So a little backstory to my whole career is I grew up here in the Denver area in the 1960s and 70s. And back then, like now, people in Colorado were very interested in lifestyle. They were also interested in some alternative things. And, marijuana was popular back then and unusual herbal therapies. And there were a few people doing yoga. And so I grew up around that. And then after high school, I left for 20 years and got very formal education and got a PhD in pharmacology and did a fellowship for 3 years. And then I came back home, and when I returned to Colorado, I remember thinking well, I've got every toolbox I could possibly have with all this training. And it wasn't true. So within a few weeks, I was very humbled because I realized that most of my patients, and we did a survey to show this, most of my patients back then were more aligned with what they were doing with their lifestyle or unconventional therapies than they were with conventional medicine. And they would ask me questions about lifestyle and unconventional therapies. And I had no idea how to answer them because I had actually gotten 0 training in all of that. So then I started trying to answer some of the questions. And when I started answering them, I realized, wow, this therapy could be really helpful for people with MS, and it should be the standard of care, and it should be something that's being provided to people with MS. And also, some of what people were asking me about wasn't that common, but some of them could potentially kill the person, and I didn't know that, and I didn't know to share that information with them. So that became my career, to use my fancy academic background to answer the day-to-day questions I heard in my clinic, and then ultimately to build a database of evidence-based information about unconventional therapies, lifestyle, how to put that into overall treatment plan, and then to write articles, books, lecture for people with MS and healthcare providers. In terms of the whole area, you kind of asked about the definitions. Yeah, I think there are lots of definitions out there. I think sometimes the area gets kind of clouded with fuzzy definitions. So there are very formal definitions, but yeah, I think they sometimes get misused. So that term integrative medicine, what that means is there are 3 components to it. So it's conventional medicine, unconventional medicine, which are therapies not typically taught in medical school or available in hospitals or clinic settings, and then also lifestyle medicine with things like diet, physical activity, emotional health. And integrative is bringing all of those together. And then importantly, integrative medicine emphasizes sort of treating disease, but also prevention of disease. So being very proactive for something that could happen 10 or 20 years in the future, and really trying to use these various approaches to have treatment as well as prevention effects.
Well, I'm glad you mentioned definitions, because when we talk about integrative medicine, there are several terms that can be confusing to some people. Can you help us understand the differences, if in fact there are any differences, between terms like alternative, complementary, integrative medicine, and integrative health?
Yeah, so yeah, we're diving deeper into all of this, and I think a term that's often used incorrectly is alternative medicine. If someone's using alternative medicine, that means that that they're using something that's unconventional and not using anything that's conventional. That's actually quite rare. In the US, in the general population, people with MS, that's a very small percent, maybe 5 or 10%, who truly use alternative medicine. But if you use something unconventional like acupuncture, along with conventional medicine, then that's complementary. If you do just acupuncture and you don't do something conventional, then the acupuncture becomes alternative. And then lifestyle medicine, which I think a lot of physicians don't even know that term, and sometimes I use it and they kind of roll their eyelid like, well, that's really interesting. Could you use lifestyle as medicine? But that's a whole field. There are textbooks written on that. And so the lifestyle medicine piece is using people's lifestyle approaches to treat or prevent disease. And then integrative medicine is integrating all of those, and integrative health means you're kind of taking stock in all of these approaches. And I think a confusing aspect of this is that once you get into this broad territory, there isn't like an algorithm. There can't be, because many of these things are very dependent on who someone is as a person. They're very much decided by the preferences of the individual. For example, for exercise, are you going to do some crazy, extreme aerobic exercise or something more gentle that's aerobic? Are you going to focus more on conditioning or strengthening? And so diet, same thing. There's not one magic diet. So the diet that's works for one person may not work for the other in terms of that person's personal preferences. So to me, that's, a lot of these things get into just sort of what gives life meaning and joy. And you don't want to excessively medicalize food. We want to keep that sort of so that it meets the enjoyment factor for someone and also is healthy.
Well, you've just touched on so many things that I hope we have an opportunity to dive a little deeper into. Let's start with this. As an integrative medicine specialist, how do you approach treating MS?
Yeah, what I often, I was checking the webcam earlier to see if I could do hand movements here. So I do this multiple times per day with my hands. So I'll try to do it with the camera here. So I think conventional medical therapy, kind of the current standard of care, is really focused on the disease-modifying therapies to try to slow down the disease process, and then using conventional therapies to manage the symptoms. So you kind of have two elements for the standard of care. And then when you start getting into integrative care, then for the symptom management, you're adding in using unconventional therapies and lifestyle approaches. But then there's this whole other hand, so 5 other areas to get into. So there's physical activity, diet, emotional health. This one's 2 things: tobacco, alcohol use. And then the 5th area is doing everything we can to keep the rest of the body healthy. And the best way to keep the rest of the body healthy is to do the other 4 factors there. And I think often with MS, and I think with any medical condition in the US, it tends to get very, very subspecialized and very focused on, in the case of MS, on the central nervous system and the immune system. But that's happening in the whole body, in this whole machine, amazing machine we have, and that machine's normal, healthy operation is very important in terms of the overall course of MS.
As we were planning this conversation, you made it a point to mention that integrative medicine is evidence-based, but underutilized. And I'd like to talk about that for a moment. What do you mean by evidence-based? And what makes you say that integrative medicine is underutilized?
Yeah, so the evidence base for it, which has been growing over the last 20 years, relates to the factors that I just went through. I'm talking about these 5 factors, but there are sub-elements to those. So if you think in terms of the elements I talked about, so there's physical activity, there's diet, like a generally healthy food diet. A subcomponent of that is vitamin D. Another subcomponent is weight management. Then you have emotional health. Most of the data is related to stress, lack of tobacco smoking, alcohol in moderation, and then keeping the rest of the body healthy. So I just reeled off 8 factors there. And if you look at those 8 factors, we now have evidence or emerging evidence relating those 8 factors to the risk of developing MS, the risk of having an MS attack or new lesions on an MRI, risk for disability progression, or risk for symptoms becoming more severe. So that's what I mean by the evidence base for it. And then in terms of it being underutilized, that just relates to the fact that this is not, certainly the unconventional piece by definition, unconventional medicine is not typically taught in medical schools or available in clinics and hospitals. So, and I certainly see lots of patients who've had MS for 5, 10 plus years coming to me for a 3rd or 4th or 5th opinion. And a lot of what we talk about, like what we're getting into today, they've never really heard that, or they never heard it in detail applied to their specific clinical situation. I think there also are kind of systemic issues that make this very hard to do. So for example, if in medical school and residency training, physicians have no exposure, it's very difficult to start going into practice and then build up a fund of knowledge and get experience and then build on that. That's a little too late. So if it's not in the foundation of knowledge coming out of training, it's very hard to utilize it. And then another systemic factor is just insurance reimbursement for seeing a physician for MS care. Physicians get reimbursed for a short amount of time. MS conventional medical care now is very complex, dealing with complex drugs. It can have potential beneficial effects, but adverse effects, and tracking MRIs and blood tests and all of that. Just kind of going through what I just mentioned, that often takes longer than the time you're allotted by insurance companies. So then it ends up being kind of an economic challenge. Even if you're oriented to do this as a physician, there's not, it will typically, I think, probably double the time of a visit to get into the whole integrative approach.
A minute ago, you mentioned vitamin D, and I'm glad you did, because every week we receive questions about the use of nutritional supplements in treating MS. For example, we heard from Timothy, who says he's considering taking vitamins D and B12 to help his MS, but he's unsure of how much he should take. What can you tell us about the use of supplements to treat MS, and what should people really be thinking about when they're considering nutritional supplements?
Yeah, well, that's a great question. And I like the specifics that Timothy brings up there. So those are certainly the supplements that I talk to every patient of mine about, because I think we have evidence that we should pay attention to them. The exact application and the exact best clinical trials with those haven't been done in MS, or they're being done. But if you look at dietary supplements, vitamins, minerals, the two, to me, where we have the most compelling evidence are vitamin D. That's where we have the best evidence. And then B12, it isn't a sexy, trendy nutrient, vitamin B12, but I think it's got important MS relevance. So in terms of vitamin D, we have more than 100 studies associating low vitamin D with negative effects in MS. that's an association in terms of formal clinical trials, like giving half a group vitamin D, half placebo, tracking them over time, really rigorous studies. The jury isn't in on that one. So it's still not definitive with high level, what are called intervention studies, but the data is compelling enough, and it's a simple, safe enough intervention that I think that's one to pay attention to in terms of just sort of stacking the deck with all of these lifestyle factors. So how much to take? You don't know unless you've checked the level. So I'm really not in favor of just sort of blindly telling everyone with MS you have to take 2,000 or 4,000 or 5,000 units a day, because some people don't need any and some people need a higher dose than others. So I do think you need a vitamin D level. And then for me, based on my reviews of the literature, I think people should aim for a level of 35 to 55. And I think what's often not talked about with vitamin D is there is probably a Goldilocks phenomena with that, like we have with other nutrients, where you don't want too little or too much. People often talk about just the too little aspect of it, but there are multiple studies showing you get good health effects with vitamin D up to a certain level or dose, and then you go up higher, and then you start having negative health effects. And that's not surprising. We've known for decades of this Goldilocks phenomenon. So the happy midpoint to me is the high end of normal for people with MS, 35 to 55. And then the dose depends on what level you have. Like I said, the much less trendy supplement is vitamin B12, but low vitamin B12 may occur in a subgroup of people with MS and may have higher risk for that. Also, just vitamin B12 deficiency in the general population has increased in the past decade. And the confusing thing in people with MS is vitamin B12 deficiency can mimic MS. So what you don't want to have happen is you're kind of treating someone for MS, they have more MS symptoms, and then you start changing all kinds of MS therapies in response, when in fact the person's just becoming more and more vitamin B12 deficient, and the MS therapy changes are really not going to help the symptoms that they're having. So to me, that's very important to check. And like vitamin D, it's so easy to correct it. And like vitamin D, you can give what you think is needed to correct it, and then 6 months later, check the level. In terms of the other part of the question, kind of what other supplements to think about, to me, it's a pretty short list of supplements to think about. So D and B12 are the top of the list. And then beyond that, it's really not entirely clear. We got on this detour that lasted, it has lasted 30 or 40 years in the nutrition field, where I think they were just trying to do the best they could with nutrition approaches. But starting 30 years ago, there was kind of this idea, well, if this particular food is healthy, like antioxidant-rich food is healthy, then it must be as healthy or healthier to take one of those antioxidants out, like vitamin E, and give it and purify it, and then give it in gigantic doses, and that will duplicate the health effect of the food. And it's kind of, now you think back, like, how did so many people, world-class scientists, researchers, kind of get onto that? And some of those people are now saying, that was just too simplistic. So the trend now is to be, instead of thinking about instead of a kind of a shotgun approach with supplements, you really want to be very targeted with the supplements and really think more about a generally healthy diet, generally healthy food. And also, just quickly say, there are now more than 30 studies showing modest doses of vitamins and minerals can have a negative health effect. We used to think they were all neutral or good. If they're all neutral or good, we should all be taking 100 a day. But if some are actually negative and you don't know which ones, then you have to be quite thoughtful about it.
I'm glad you mentioned diet again, because we've heard from another one of our viewers, Patricia, who says she was diagnosed with MS last year. She's on a disease-modifying therapy, but Patricia wants to know if there are things she should be eating or she should not be eating that would help slow down the progression of her MS. So again, what do we actually know? What does the evidence tell us about diet and MS?
Yeah, so real broadly, there's evidence, and I won't go into the specifics, but that generally healthy, especially plant-based diets, may have beneficial effects for some of the symptoms of MS in terms of slowing down the disease process. That's not clear. But very importantly, and kind of relating to this whole integrative approach, a generally healthy diet is one of the best ways to avoid lifestyle-induced diseases like obesity and diabetes and high blood pressure and high cholesterol and heart disease. And like I mentioned, we have lots of good evidence that if you have MS, you want to try to avoid having other medical problems, especially if they're entirely avoidable, if they're lifestyle-induced diseases. So to me, the strongest connection of diet or one strong connection to diet is sort of indirectly, like a healthy diet is going to help prevent diseases that might secondarily have a negative impact on MS and overall health. So then the question is, well, what's the best diet for MS? And I'd be shocked if we ever find the best diet for MS. You know, we're still a little early looking at that in MS, but certainly for diabetes, obesity, high cholesterol, they've been working on that for 30 or 40 years. What's the best diet for those? There isn't one. There are many different diets that can work. The commonality to those diets for those conditions, and I think that's probably going to end up being applicable to MS, is, and I'm quoting Michael Pollan here, real food, not too much, mostly plants. And if you can, and I actually add one word at the end, which gets back to what something we started with earlier. So real food, not too much, mostly plants, enjoy. You really got to, you know, exercise, diet, you really have to enjoy what you're doing for it to be sustainable over the long term. So those are the basic principles, but then you can get into, if you want a structured diet, then, you know, the diets where we have evidence basis for. So the Mediterranean diet, TLC diet, there's a newer diet called the MIND diet, you know, a proprietary diet, Weight Watchers, you know, if you look at the top 5 or 10 diets where there's evidence, those are the ones that are going to follow the principles that I mentioned.
An
example I give, which, you know, there's talk in the nutrition field that sometimes it's sort of deliberate confusion that's thrown out there by people promoting a diet, or, you know, I think sometimes by the media trying to make a new diet study sound flashy, when it's not the most exciting news report or diet information to say, keep saying over and over, real food, not too much, mostly plants. So I think often the way things get confounded is in nutrition studies, you know, in MS some, but more in the just the general health area, is that people find a diet has a beneficial effect and then they attribute the beneficial effect to that diet. When in fact what they don't control for, or they control for but don't measure so much, is, you know, people in these studies often start out with the worst diet that's out there, which is the standard American diet. And then they can get converted to whatever the diet is that's being studied, and there's a beneficial health effect. And then that stated that diet gives these health effects, but much of what may be going on is they're just coming off the worst diet in the world. You know, so we don't know the best diet, but we do know the worst diet. So an example I give is some guy hitting his thumb with a hammer, or one guy hitting his thumb with a hammer starts eating bananas, and he says bananas cure thumb pain. Another guy doing the same thing starts watching TV instead of hitting his thumb with a hammer, and he says TV watching cures thumb pain. And then the two of them get on TV and debate whether bananas or TV watching cure thumb pain, and it's kind of missing the point. It's removal of something negative as opposed to magical positive.
That's a great analogy. Thank you for that. Diet tends to go hand in hand with exercise. And Julie wrote to say she's having a difficult time getting motivated to exercise in her home since COVID-19 is keeping her at home. She's asking, how important is it for her to exercise regularly in managing her MS?
Well, I love that two-part question also. So the first part, to me, that's probably the most important part, the difficulty getting motivated. And that's something you really have to find within yourself. Like if you don't have that, if I have patients who don't have that, I tell them, instead of exercising for the next month or two, I want you to sit in a chair and try to figure out what's going to get you motivated. And that way, there's a lot of soul searching that happens there. What are the obstacles someone has? And then a nice way to get an exercise program going. And I have patients who start laughing when I say this, but I say once you get some feeling of motivation, then I want you to start an exercise program that's going to be 2 minutes per week. Those are loud, like, but then we come up with a schedule. 2 minutes a week for 2 weeks, 2 minutes twice a week for 2 weeks, and then you build it up. If you kind of do this, however, you can build it up very slowly, and still in 6 months, you've got a 3 days a week, 30 to 60 minutes per exercise session program that's been put together. In terms of physical activity and MS, I told you about that, all those 8 factors we started with, the integrative health factors. So some of the best evidence we have is for physical activity potentially having beneficial effect on slowing down the disease process. Certainly if someone's got progressive disability and they're not exercising, there's lots of deconditioning that can be overcome by physical activity. Symptom severity may be lessened by some programs of physical activity. And then physical activity can help prevent these other medical conditions, obesity, diabetes, that can secondarily negatively impact MS. I sometimes say that if exercise was a medication, that would be by far the most common prescription I've used in my medical career. And in terms of the physical activity, I said there's no best diet for MS. There is a worse diet. There's no best diet, and there's no best exercise program for MS, and it's something that really needs to be tailored to the individual. I think physical therapists are excellent ones to design a program, but then that's really got to be integrated into who someone is as a person. But basically, 3 to 4 days a week, 30 to 60 minutes per exercise session, 2-to-1 ratio of aerobic to strengthening, also stretching and balance exercises. And then what I talk about a lot too is what's often left out of American exercise programs, unfortunately, is to just have fun relaxing during or after. You don't have to get into a deep meditative state or have some special program, but just like lie on the floor at the end. There are all these relaxation molecules produced by exercise. Why not take them in for 5 or 10 minutes instead of quickly changing clothes and getting back to a hyperactive lifestyle? You add a little extra time and have fun with it. And if you do that, it might be more likely you go back to do it, because maybe for a while or maybe forever, the favorite part of exercise is the end when you relax.
Well, we know that emotional health is crucial to overall well-being, but it's often overlooked. And this has been a particularly emotional time for so many people who are already living with the uncertainty of MS, now also facing the additional stressors of the COVID-19 pandemic and the emotional impact of the social unrest as members of our communities respond to racial injustice. What advice can you share on how people can best manage their emotional well-being?
Yeah, that's a gigantic territory. So I do think that's something that's important. You said it's often not fully addressed. So that's certainly something people need to be connected with their healthcare providers. That could be their MS neurologist, primary care provider. Something you want to watch for significant depression and anxiety. Obviously, we have medication, psychotherapy that can help with that. And then I do think I've seen this in many of my patients, including, I guess it's most dramatic in younger men with an MS diagnosis who really don't have much emotional sense of themselves, that, MS can be sort of a jumpstart to developing emotional literacy, really kind of reading your own emotions in real time. I think if people have emotional literacy, really being able to identify and process emotions in real time, that's a great prevention for depression and anxiety. Depression and anxiety are sort of the end result of months, years of not doing what I just described, not doing the emotional processing. So to be mindful of that, a little like you're mindful of a physical activity program. So certainly, psychotherapy can be used to develop emotional literacy. If you kind of look beyond just sort of confronting your emotional self, the best non-drug antidepressant approach is physical activity. That one keeps coming up as we're talking here. So I think that's something, and there's also something I refer to, this is my own made-up term, but exercise withdrawal syndrome. So, if someone's exercising regularly and then they're getting good emotional benefit from that, and then a pandemic comes along and they're not doing it so much, then they've got potential exercise withdrawal, which is like taking away a drug. And so you can have multiple MS symptoms, including mood issues, can become worse with MS if you drop down the physical activity piece of it. Oh, and I'll make one other comment, which I found interesting. I haven't seen this in the literature, but something that struck me, and this is more my patients who've had MS for 5+ years, but it was really kind of striking to see it initially during this pandemic, but kind of ask people how they're doing with their mood and emotions during the pandemic. And a lot of my patients, there's sort of this long pause, and then they say, I'm doing great. And I think this is people who have really wrapped their head around their MS diagnosis, and this was what people tell me. Like, they wrap their head around their diagnosis, they've taken that in emotionally. And for them, this isn't everyone with MS, but for these people, which is a lot of people I've talked to, pandemic's no big deal. Like, MS was the big deal. And that was a bigger deal than a pandemic, and the big deal of dealing emotionally with MS gave them this toolbox of psychological skills where they're way ahead of their partners and families and friends with coping with the pandemic.
I'd like to make sure that we touch on how integrative medicine relates specifically to COVID-19. But before we get into that conversation, I just want to take a moment to welcome those of you who have been joining us via GoToWebinar, Facebook Live, and YouTube Live. Please let us know what's on your mind. Post your comments and questions on Facebook and YouTube, or type them into the questions box if you joined us on GoToWebinar. Our Ask an MS Expert live event takes place at this same time every Friday. So please help us make sure that everyone knows about it by sharing news about the webinar with your family and your friends. We're talking with Dr. Alan Bowling, who's been helping us understand how integrative medicine impacts MS. Now I'd like to take just a moment to talk about how integrative medicine is having an impact on the management of COVID-19. This is the 14th week in a row that we've updated everyone on the impact of COVID-19 and MS. And I was excited to hear that there are relevant and important connections between integrative medicine and COVID-19. Dr. Bowling, can you talk a little bit about what those connections are?
Yeah, it's been interesting to track all of this, and sort of, as an integrative medicine person, think of COVID-19 through the lens of integrative medicine. So I'll just touch on a few things. One is there's a lot of talk about potential connection of vitamin D to COVID. to me, it's too early to say exactly what the connection there is. Scientifically, it's really intriguing that, you know, vitamin D has potential antiviral effects. So it could have potential modest effects on the COVID virus itself. And then I think often what doesn't get talked about a lot with COVID is, you know, many people die with COVID or have severe disease, not because of the viral infection, it's because of a hyperactive immune response. And so vitamin D has this immune regulating function that could potentially damp down that hyperactive immune response. So vitamin D has two characteristics that could have a beneficial effect. I don't think it would become someone has bad COVID and you give them vitamin D and they recover more quickly. It's more like maybe that could be added in, but the data's quite early on that. There are also more severe COVID, especially the more severe excessive immune activity with COVID has been associated with low vitamin D levels. Like as I was saying with vitamin D and MS, those are association studies. You really need vitamin D, placebo, people on COVID, people with COVID, and kind of track over time. So we don't have that data at this point. It's also, you know, vitamin D can be what we call a surrogate marker for a healthy lifestyle. So vitamin D levels go down, for example, if people are overweight. And so someone says low vitamin D, it could mean that they're overweight. If you're overweight, it could be you have unhealthy diet and physical activity programs. And so it could be that with COVID, the low vitamin D is just what we call a surrogate marker. Maybe those people also have obesity, which we know is a risk factor for more severe COVID. And then it's interesting, its paper just came out a week ago out of the United Kingdom. Thousands of people looked at, and what they found was that about 50%, it's complex statistics, but basically about 50% of the severe COVID cases could be attributed to unhealthy lifestyle factors. And things that we know about with COVID, so it's obesity, high blood pressure, you know, lung injury due to long-term tobacco smoking. And there's some other lifestyle factors that could play a role as well. And then the other thing, I mean, you talked about sort of the stress on people with the pandemic, but the social unrest and maybe some social changes that will come out of that. You know, something that goes through my head often is Charles Dickens died 150 years ago this week, but it was the best of times, it was the worst of times. You know, often, you know, life is full of juxtapositions. So, you know, maybe at the social level, this is sort of a mix of some bad with some good that could come out of it. And then I didn't really talk about it on the individual level with MS. You know, there's some parallels with that, sort of this juxtaposition, worst of times, best of times kind of thing. There've been studies looking at how do people, this relates to Charles Dickens and the pandemic and all of that. But the question is, how do people get a healthy lifestyle change? How do you do that? Do you read a book? Do you make a New Year's resolution? Do you watch a TV show? And generally, the profound, sustained changes in lifestyle are not any of those. They're what's called crystallizations of discontent, like an unexpected life event comes out of nowhere and it's very negatively charged with emotion. And like I said, that's been studied. Those are potent events. And so that's what it feels like in my office when I diagnose someone with MS, what I just described, crystallization of discontent. And pandemics at the social level might be crystallizations of discontent, and you know, those kinds of things can motivate people.
Well, now I'd like to focus our time on addressing more of the questions that our audience has for you. Karen writes that she's happy we're talking about this topic because She's been managing her MS without disease-modifying therapies for the past 17 years. What do you advise your patients in terms of disease-modifying therapies?
Yeah, the way I talk with my patients, I'm not a gambler. I tell them that. But when and I don't actually wear a lab coat when I'm seeing my patients, because that feels a little too scientific. When I'm treating MS, when I'm talking with my patients, I feel a little more like we're in Las Vegas. We're just trying to play the odds the best we can with all the variables that we can work with. So we certainly talked about those 5 variables, the typical integrative health approaches. And then to me, the other 2, the disease-modifying therapies, conventional symptomatic management, I think there are very good things that can come out of that. I certainly have a subgroup of my patients, not a high percent, but a subgroup who choose to not go on disease-modifying therapies. I do tell people, I'm here to give you the information, weigh risk benefit. I could tell you what I think, but you're the final decision maker here. And I do believe that. But if you're going to play the odds, we certainly have lots of evidence with the disease-modifying therapies in terms of the clinical trials that have been done. I do think it's kind of crazy making for some people, individuals with MS who are not in the clinical trials, to have confidence it's doing the same thing to them as people in the trials. So you have to have an element of faith with that. I think the question gets to something that really intrigues me, having done integrative medicine for 25 years with this integrative approach in a state that embraces healthy lifestyle and this whole integrative approach. So I think I have a pretty unique practice with people they've gotten A+ doing the integrative health approach, especially lifestyle medicine approaches, for 20+ years, ever since I met them and gave them the diagnosis of MS. And some of those people, when I first met them, they had some very concerning factors for how the MS might play out over time. So prognostic factors that were quite negative. And now, I can say 20 to 25 years later, I've been with them through the whole course. And some of them are like CEOs of companies. There's one guy in his 60s who does half marathons at high altitude. And you look back at how he presented to me when he was diagnosed, and I can't believe that's how this played out. And some of these people, contrary to what I recommended, did not go on disease-modifying therapy, but they did the lifestyle stuff extremely well. I want to emphasize, I'm not recommending you should not go on disease-modifying therapy and just do the lifestyle approach. I'm just saying there are some striking examples that I've seen. I've seen people who've taken that approach and it has not gone so well. We're still learning about MS. Could there be subtypes of MS? Could there be subtypes of MS that are very lifestyle responsive and others that aren't? And maybe some are very lifestyle responsive, and if you optimize lifestyle, maybe the MS follows a milder course. Others may just have such a strong immune malfunction that you need a drug to counter that. So with heart disease, I think that's an example that might be analogous. So a lot of heart disease is lifestyle induced. You correct the lifestyle, you can actually you can reverse some heart disease that way. But some people have a genetic abnormality that gives them really high cholesterol levels. And those people, lifestyle is not going to work. Those people need aggressive drug management. So we may have the same kind of thing with MS. If you're not taking the drug approach, you got to be on it with doing all the non-pharmacologic approaches in a very, I would argue, evidence-based way, and really kind of checking yourself and having guidance on that.
Talking about managing some MS symptoms, Michael experiences pain and wants to know if he should be using cannabis to help manage his MS pain.
Yeah, that's about a 3-hour answer that I have to that question. So I'll give you hopefully a few minute answer. So there's certainly some of the best evidence we have for cannabis helping with medical conditions is with MS. and specifically with MS-associated pain and also spasticity or muscle stiffness. There's also some evidence for bladder dysfunction and sleep in MS. That high quality data is generally derived from studies with high quality pharmaceutical grade cannabis, not the products that are sold in dispensaries. So unfortunately, there's kind of a disconnect between the clinical trial data we have showing beneficial effect and then what products people with MS have access to through cannabis dispensaries, in that the dispensaries don't have the products where beneficial effects have been seen, and one cannabis product is not the same as another. Cannabis has beneficial effects, like I've discussed. I was on a paper where we kind of highlighted these beneficial effects. Cannabis also, like any medication, has potential adverse effects. There's addiction, psychosis, possible suicide increase, stroke, heart disease, prostate cancer, possibly CBD specifically can cause liver toxicity. That's just a very short listing, but there can be drug interactions. Products sold at dispensaries have limitations potentially with pesticides and solvents. The labeling can be incorrect. The staff may have no scientific training or expertise, but they're recommending and dispensing products. So what I just listed that's typical for any medication. You have potential beneficial effects, but you have to balance those with the potential negative effects. And the extra thing with cannabis at dispensaries are limitations to those products that are unique to that particular setting. So I think people with MS thinking about using cannabis for pain, you really have to think it through carefully and get the objective information, and that can be hard to do. I think at the end we're going to mention, I do have a website that I think you're going to mention. On that website, I put a lot of time into trying to put a condensed version of a benefit risk with cannabis for people with MS into just a 2-page handout, kind of like what you get when you go to the pharmacy for a medication. And it follows the format of what you get at a pharmacy, called the prescribing information. So if people are interested, they can go to the website, and there are 2 different pages, 2 different parts to the cannabis information. And that's how I start my discussions in my clinic. And I don't get into the pro and con, whether it should be legal or not, but I'm very pro informed decision making. And I'm really concerned that in the area of cannabis, there's not informed decision making happening. And there have been studies of people who use cannabis, healthcare professionals, including physicians, showing a stunning lack of knowledge despite the widespread use. And that, to me, that's a disservice to people with MS, to not transparently share the information that's in the 30,000 publications related to cannabis in the medical literature.
Well, we're going to help people get to your website in just a moment. I want to thank everyone who submitted their questions and comments today. And thank you, Dr. Bowling, for sharing your experience and expertise with us today.
Okay, I think great. Thanks so much for inviting me.
Of course. I think that one of the best things that anyone can do for themselves, especially during these uncertain times, is to make sure that the information they're getting is credible and reliable. So we'd like to share some resources with you. And these are resources that you can count on to be up to date, they're current, and they're credible. First, I'd like to acknowledge that we're in the midst of an emotionally difficult time for so many people. And I want to make sure that you're aware of some resources that are available if you find yourself in emotional crisis. The National Suicide Prevention Lifeline is available 24/7. They offer free and confidential support for people in distress, as well as suicide prevention and crisis resources for you or your loved ones. And you can reach them by calling 1-800-273-TALK. The National MS Society's MS Navigator team can also connect you to support groups and other support resources that can help. And since we're talking about MS today as it relates to COVID-19 and integrative medicine, I want to circle back to something that I said earlier. If we haven't gotten to your questions, please know that the National MS Society's MS Navigator team is available to answer those questions and connect you to the very best resources. I'll share all the ways that you can connect with an MS Navigator in just a moment. You can always check the Society's website at nationalmssociety.org/COVID-19 for complete updated information on COVID-19 and MS. And as we just discussed a moment ago, for more information on Dr. Alan Bowling's published books and articles, and just a ton of really great informative information on integrative medicine and MS, you can visit his website at neurologycare.net. And every week on the Real Talk MS podcast, I continue the conversation that we start here. So I hope you'll take a few minutes and give Real Talk MS a listen. You'll find Real Talk MS at realtalkms.com, on Apple Podcasts, Google Podcasts, Spotify, Pandora, or wherever you find your favorite podcasts. Now, I promise that we share all the ways for you to contact an MS Navigator with your questions, and you can find them on the MS Society's website at nationalmssociety.org. You can contact an MS Navigator by telephone at 1-800-344-4867, or you can email your question to an MS Navigator at contactusnmss@nmss.org. You can also connect with the National MS Society on your favorite social media channels, including Facebook, Instagram, Twitter, YouTube, and LinkedIn. And when you do, please make sure to like those social posts and subscribe to those channels. And you want to make sure that you get on the Society's mailing list by signing up at their website. That way, you'll receive regular updates on upcoming programs and the latest information on MS treatments, research, and how to live the very best life with MS. I'd like to thank Dr. Alan Bowling for sharing his information and insights with us today. And I'd like to thank everyone who's joined us today for your great questions. Please remember that a recording of this webinar is going to be available for your review on the Society's website at nationalmssociety.org/MSExpert. And MS Expert is all one word. Now I have a little favor to ask each of you. Getting your feedback on today's webinar is important. So you'll see a survey pop up in a moment, and when we close out the webinar, it would be great if you took that moment to fill out that survey. If you happen to be watching on Facebook Live, you'll see a link to that survey pinned to the comments section, and on YouTube, you'll find that same link in the program description. Completing the survey makes a real difference. The information you provide helps us continually improve, and it helps shape future webinars. As I said, the survey takes a minute and makes a difference, so please take a minute and fill it out. On behalf of Dr. Alan Bowling and the National MS Society, I want to thank you once again for joining us. Please stay safe and make healthy choices.